It all depends on what type of bone cancer someone has. If it is a secondary type of bone cancer where the cancer has started somewhere else and gone to the bone, again, otherwise known as a metastasis, treatment really depends on where the cancer started from, because that's going to be the thing that is going to be the most risky as far as tumors showing up somewhere else and potentially being a life-threatening condition. And so once the diagnosis is made on a biopsy and you can confirm through other X-ray tests, typically CAT scans, where the cancer started from, there's usually a referral to a medical oncologist to look at additional modes of treatment, typically consisting of chemotherapy, to get the primary tumor under control, or get the cancer under control where it started from. As far as the metastasis or the secondary bone cancer itself, if it's weakened the bone enough that the bone is at risk of breaking, then surgery may be recommended to help stabilize the bone or strengthen it so it's less likely to break. If it's a primary bone cancer, so a cancer that actually started off in the bone, once that diagnosis is made, again, additional X-ray studies just to see if the cancer has spread anywhere else. Typically, we're looking at lungs and looking at other bones. The next step for that depends on what type of bone cancer it is. For the most common types that we see, and again, those are mostly in children, you're usually looking at chemotherapy, so medication first, followed by surgery, occasionally radiation, again, depending on what type of bone cancer it is. If it's a primary bone cancer in an adult, again, depends on what type of cancer it is. That's frequently surgical intervention, or actually cutting out the cancer and trying to put things back together. Potentially chemotherapy, again, depending on what type of cancer it is. When you're looking at surgery for the primary bone cancers, whether it's in a child or in an adult, there are a couple of ways to go. One is amputation. That's always an option, but not everybody needs an amputation. So patients frequently will come in concerned that they're going to lose an arm or a leg. It may be if the cancer is that far advanced, but there are other things to do. It's a thing that's called limb salvage, where you actually take out that piece of bone where the cancer is, and then there are many, many ways of trying to put things back together.